I'm Bill Galderas with Fathom Healthcare. Last week, it was announced that one of the country's largest healthcare systems had been the victim of a cyber attack. Now, at Fathom Healthcare, we serve 15 healthcare systems representing nearly 800 facilities, and 10% of the U.S. population is served by our clients. So we take healthcare information very seriously here. Today, I'm being joined by Jay Ketchaver. Jay is the Manager of Information Technology Security for Fathom, and he's going to give us some tips about keeping our own network safe. Jay, thanks for joining us.
No problem. Thanks, Bill.
Now, Jay, can you first of all just give us the lowdown a little bit? What are the details of this attack? What exactly happened?
Yeah, like you mentioned last week, one of the largest healthcare systems in the U.S. Notified the government that they were the victim of a cyber attack, and they hired a security firm to look into, where did this come from? And that firm was able to trace it back to some hackers in China who may or may not be linked to the Chinese government. Obviously not a good thing. These hackers got into the system, and they were able to access all kinds of personal data, like social security numbers, from millions of patients' records in the healthcare system. So obviously that was not a good thing at all.
Now, very scary, Jay. So can you tell us, what's the first step? A hospital or any kind of health organization, where do we even get started?
If you don't already have a comprehensive risk assessment plan, definitely put one in place. This is kind of an overarching, high-level view of any areas of your system that may be at risk. Either IT systems, maybe you're following some outdated policies and procedures, things like that. This risk assessment plan will help you isolate and hone in on any holes or weak areas that you have. It can help you to align your system to industry best practices. You can make sure you're always staying up to date on potential threats and ways to mitigate that. So definitely do that risk assessment plan. Another thing you should always be doing, at least annually, if not more than that, is regular security assessments. Your internal IT team can do this. They can test your systems. What I would recommend is getting a trusted third party to come in and actually do this for you. They should be impartial. They'll have ways to test your network, see if they can get into any public-facing servers you have, any public-facing networks like that. So they'll see if they can break in there like a hacker would. So that's a really good way to isolate any other areas that you have that you need to mitigate and get fixed up. Another very big thing that a lot of places overlook, unfortunately, is security awareness training for your end users. That's anybody who's using a computer, a desktop, laptop, tablet, anything like that. These security trainings will educate your users on what they can be and should not be doing, because there's a lot of common mistakes that are easy to avoid. You just have to know what to look out for.
Okay, great. Can you give us an example? What are some of those mistakes?
Probably the biggest one that I see and that people deal with is end users clicking on links in phishing or spam emails or opening up attachments from those things. If you get an email saying it's from the IRS, it's probably not from the IRS. It's actually from a spammer. And if you click on a link to go put in your information because you're trying to do the right thing, you're actually going to a bad website. These hackers can then steal your information. They can install malware on your computer so they can control your computer, steal information from that, or even get into your company's or healthcare system network, get into the network and actually start infecting more computers there and stealing more information. That's probably what happened with this latest attack, I would say. It's very easy for hackers to get in that way.
Okay, great. So aside from this training, this end-user training, what are some technical safeguards that companies should be putting in place?
Well, always make sure you've got antivirus and anti-malware programs running on all of your computers. You can put those on tablets and smartphones too if you want to be really, really careful. Make sure those are always updating at least daily, if not more. Those will help to catch any infections, block any incoming attacks like that. And then you should have a central monitoring console for these, so make sure you're reviewing that on a regular basis too. Try to do it at least daily. If you're seeing a lot of alerts popping up, that'll let you know, hey, there's something going on here. We've got some people trying to do stuff, or you may be able to discern some patterns, see what's going on there. So just make sure they're updating and keep an eye on them. If you've got confidential data, personal data on laptops or other mobile devices like a tablet, you should think about encrypting those too, because then even if that laptop is lost or stolen, if the data is encrypted, there's really no way to get to it. So make sure you're doing all those. Those are all pretty easy to put in place.
Okay. Now, Jay, a lot of our viewers are just going to be people there working in hospitals, working in doctors' offices, working at healthcare facilities, not the network admin, not the security folks. So as an everyday user, what are some simple things that I can do to protect patient data?
Just make sure you're updating your system. If you use a Windows computer, you probably have seen the Windows updates. Make sure you're always installing those on a regular basis. Try to do it as soon as you get them. If not, then at the end of the day, at the end of the week. Microsoft is always patching holes in Windows. So make sure you do that. Hackers are always looking to exploit that type of thing. That goes for Macs too. You know, they're not as commonly attacked, but if there are updates for your Mac, make sure you're installing those. Make sure you're installing software updates too. Hackers love to get in and exploit common applications and programs like Java. Everybody has Java. You know, there are always updates coming out for that. Make sure you install those. Same thing goes for Adobe too. There's always updates coming out for Adobe. So any common programs like that, if you're ever prompted to install an update, just please do that as soon as you can.
Great. Now, Jay, I'm sure you see the same thing. You're in a hospital waiting room, a doctor waiting room. Everybody's on their tablets. Everybody's on their laptops. They're checking email. They're checking their phone. There's an expectation that a hospital or healthcare waiting room has Wi-Fi. How can you possibly protect your network when you have all these unknown users and unknown devices on a network?
Yeah, never allow any unknown devices onto your primary work network. Some of the networks where you have confidential data stored on your servers or things like that. Always make sure you have guest wireless networks set up. These networks will allow people to connect to them and access the internet, but they're segregated from your primary network. That way, it's a lot harder for any potentially malware-infected systems to get from that segregated guest network onto your primary network. They're really not that hard to set up. They're pretty easy to do. Just make sure you keep them segregated, and again, review those from time to time to make sure there's nothing odd going on those.
Okay, and so that leads to the next question. And so for both those guest users and your regular known users, is it a good idea to limit the websites that visitors can access?
I would say where it's possible, especially for your internal users, yes, do this. Just because there are so many websites out there now that either are malicious from the start, they contain malware, or even legitimate websites can be hacked and malware can be downloaded from those websites. And these things called drive-by attacks. Even just going to one of those websites, you can get infected that way. So if you're limiting the websites that your users can go to, you're kind of mitigating that attack vector there. Whether you want to do this on your guest network or not is kind of up to you. That's kind of a policy decision. But again, as long as you have the guest wireless network set up and devices are using that you're not controlling, that'll help keep you secure too. But like I said, when possible, if you can, if it's feasible, I would limit web browsing from your internal computers just to be safe.
Got it. Okay. Now, one thing I've read and I've heard about is hackers they'll access a user's device. They use that, kind of a secure known device. They use that then to get to secure areas of the website. So how do you minimize that risk of a hacker kind of hijacking a known trusted device?
Yeah, one of the easiest things you can do where possible is don't give users more rights on their computer than they need. For instance, if you've got a secretary, he or she may just need to access the internet and do some word processing, work in spreadsheets like that. They don't need the rights to install whatever software they want. They shouldn't be installing games and things like that. So if they don't need to install software, then don't make them a local administrator on their computer. If they don't have the rights to install something, it's a lot harder for malware and viruses to get installed on their computer. And that kind of goes even for IT administrators like myself. Don't give people more rights than they need. If you have an IT admin who doesn't work on your email server, for instance, you may want to see if there's a way to restrict access to that. Just let people work on exactly what they need to, not more than that. Okay,
great. So at a larger philosophical level, this is just the latest story. Every time you turn on the news, every time you pick up a newspaper, every time you read news online, there seems to be another hacking story in the headline. So what's going on? Why do you see like this sudden explosion of hacking?
Yeah, well, you may have been hearing about the Internet of Things. We have more and more devices that are connected to the Internet these days. You've got laptops, desktop computers, tablets, smartphones. We're getting into wearable devices now, like smartwatches. You go home, you've got a smart TV. You may even have a smart thermostat. There's more and more things that are connecting to the Internet. And anything that's connected to the Internet is a possible venue for a hacker to get in and infect the network or take over that device. So the explosion of Internet devices is just causing the rate of hacking to go through the roof. There's just a much greater attack surface.
Okay, great. That makes sense. I understand. So you've helped us understand how to protect ourselves. You helped us understand why it's grabbing headlines. But what's the motivation here? Why do hackers hack?
Let's kind of ask, like, why do fools fall in love? Something like that. There's numerous reasons why hackers hack. Some of them are just trying to make money. They can make a lot of money if they steal somebody's social security number and sell that to a group that wants to use that for some reason. If they steal your credit card number, they can go and use that to purchase things themselves. So money is definitely a motivator. Some hacking groups, especially ones that are tied to government organizations, kind of like this Chinese cyber attack that we just recently learned about, they're doing it for espionage, basically. Not to sound too James Bondy, but they may be trying to steal, trademarked industrial designs, corporate plans, political plans. This Chinese hacking group, apparently China has a 5-year plan right now to increase the rate of the healthcare in China. So of course they're going to be targeting U.S. healthcare systems, just try to steal, our ideas, our plans. How are we doing things here to do that? And some hackers just hack just for fun. They get a rush from it. It's a big thrill to them. If there's a challenge out there, they want to see, if they can break into this, so they can brag to their hacker friends, and just they have a good time doing it. I wish I understood more, but people are complex creatures, I guess.
Absolutely. No,
Yeah.
great. Well, Jay, I really appreciate your time today, all of your help. For any of our viewers that want to learn more, you can find out more at fathomdelivers.com/healthcare. We have all kinds of resources there related to security and other topics related to healthcare technology. Jay, thanks again for your time.
Yeah, thanks, Bill.